Theresa Douglas, Project Lead for Dementia with NHS Education Scotland, talks to us about how staff can build their awareness, knowledge, skills and behaviours to support them to be effective in their role. So hi Theresa, thank you for joining us. What is promoting excellence?
So Promoting Excellence is a framework for health and social services staff working with people with dementia, their families and carers. And it details the knowledge and skills all health and social services staff should aspire to achieve in relation to the role they play in supporting people with a diagnosis of dementia, their families and carers. The framework outlines 4 levels of knowledge, skills and behaviours specific to the worker's role in relation to dementia. Rather than being hierarchical, the levels are concerned with levels of responsibility in relation to working with people with dementia, and that will vary greatly across organisations and sectors. Each individual staff member and their employer must take responsibility in ensuring they correctly interpret and apply the content and aspiration of the framework to their role in relation to working with people with dementia, their families and carers. Each level defines the expertise specific to their role in relation to dementia that a worker must have, rather than in relation to their seniority within the organisation or their profession.
So what are the 4 levels and who are they for?
Well, the Dementia Informed Practice level provides the baseline knowledge and skills required by all staff working in health and social care settings, including in a person's own home. For the Dementia Informed Practice level, there is a DVD which you can watch alone or with others to explore the areas raises, complete the reflections and answer the questions. It's an excellent resource to generate discussion within the team about your current practice, what you're doing well and how it could be improved.
And what is the next level?
The next level, Dementia Skilled Practice level, describes the knowledge and skills required by all staff who have direct and or substantial contact with people with dementia and their families and carers. And that could be a staff nurse in a surgical ward, a porter supporting orthopaedics outpatients department, a phlebotomist working alongside GPs in a health centre, and a care at home worker. It depends on the role, the setting and the needs of the person with dementia, their family and their carers. The Dementia Skilled Practice level learning resource is comprehensive, as you can see. It builds on the Informed DVD and will obviously take longer for you to complete. Some of it may not be new to you, so use it to build on what you already know, to refresh your knowledge or to learn new things to add to that. However, if you work in an acute hospital, you should use this resource because it's specifically written for staff working in that setting. The Enhanced Dementia Practice level outlines the knowledge and skills required by health and social services staff who have more regular and intense contact with people with dementia. Those who provide specific interventions and direct or manage care and services. So examples at this level could be a social worker, a physiotherapist working with people with complex physical health conditions, including dementia, and a healthcare support worker in a setting caring for older people, either in a community hospital or a care home. With Enhanced Dementia Practice level, there are a number of learning resources depending on the area of practice you need to be knowledgeable about, like supporting people through a diagnosis, so post-diagnostic support, pharmacological interventions or psychological therapies. Or it may be you have to look elsewhere for specific learning for your setting, which may be a training course rather than one specific learning resource. As time goes on, more of these will be produced in response to the services identifying training and education needs. But you might consider resources such as Think Capacity, Think Consent, or Promoting Psychological Wellbeing for people with dementia and their carers, an enhanced practice resource.
So what is the 4th and final level?
The Expertise in Dementia Practice level outlines the knowledge and skills required for health and social care staff who, by virtue of their role and practice setting, play an expert specialist role in the care, treatment and support of people with dementia, like consultant psychiatrists, GPs, dementia nurse and allied health professional consultants, specialist pharmacists, clinical educators. Expertise level learning can include a variety of bespoke and face-to-face learning opportunities, like perhaps a specific master's or a PhD, like dementia palliative and end-of-life care. The knowledge and skills outlined at each level are constructed in an incremental way. For example, staff who operate at the dementia enhanced practice level would also possess the knowledge and skills, attitudes and behaviours described at informed and skilled levels.
And what is available to support staff learning and development?
There's a whole suite of education and learning resources which you can access for free online. You can visit the Promoting Excellence website to access the learning resources I've shown you, and the Dementia Managed Knowledge Network for access to a whole range of other resources, up-to-date information and guidance. Over and above the written and online education resources, NHS Education for Scotland provides regular Promoting Excellence masterclasses covering dementia-specific topics like delirium and legislation. The adverts for these will usually come to you through your local Alzheimer's Scotland nurse consultant, or contact us through the Dementia Managed Knowledge Network.
And finally, where can staff access everything?
Everything you need is available on the NHS Education for Scotland website at this address, or email the team at mental.health@nes.scot.nhs.uk.
Theresa, thank you.
You're welcome.
Well, that wraps up our Dementia special. Thank you to everyone who contributed and to the Dementia Resource Centre for hosting us. Like and share this video and we'll see you next month.